Latham, and I have chosen Orthostatic Vital Signs as my diagnostic tool. I work in the ER and do orthostatic vital signs quite frequently, especially on patients who have the symptoms of orthostatic hypotension. So what is orthostatic hypotension? Generally means low blood pressure just when someone is standing or stands up. What can cause it? Well, a lot of diseases or syndromes that you see here can cause orthostatic hypotension. Loss of blood, anemia, alcohol consumption, just to name a few. Medications can also cause orthostatic hypertension, namely diuretics, tricyclics, antidepressants, and so forth. Any medication you take can have a side effect, and some of these medications listed here, the side effect is orthostatic hypotension. What are the symptoms of orthostatic hypotension, you say? Well, feeling lightheaded or feeling dizzy after standing, blurry vision, weakness, syncope, confusion, and nausea are some of the symptoms. Well, what's the physiology of orthostatic hypertension? Well, when someone stands up, gravity pulls that blood down to the lower extremities. That can cause a feeling of syncope or lightheadedness. Our body recognizes this blood pressure change with our baroreceptors that are found in the aortic arch and the carotids. This stimulates the body to produce a response to counteract the low blood pressure effect, or the effect that gravity has on the blood. This response can come from the endocrine system, the catecholamine, and aldosterone, just to name a few. The response causes an increased heart rate and heart contractility, as well as it constricts the blood vessels and the kidneys to hold urine. This can combat the hypotension that naturally occurs when standing up. Orthostatic vital signs are used to diagnose orthostatic hypotension. When a patient presents to the ER that have these symptoms, we check the blood pressure and the heart rate in 3 different positions, namely in the supine position, the sitting position, and the standing up position. Between each position change, we allow 1 minute between each blood pressure check after they have changed positions. So when we first start, you want to lay the patient down for 2 to 3 minutes prior to checking the blood pressure and the heart rate. You want to make sure that they're as flat as possible, using no pillows or anything underneath them to prop them up. If they're in respiratory distress, do the best you can to get them in a comfortable position. Sometimes it's recommended to take 2 measurements in the supine position, since this is going to be your baseline for your changes. Next, after the supine position, you want to check the blood pressure. So get the patient up into a sitting position and allow 1 minute to pass before checking the blood pressure and the heart rate again, using the same arm and the same machine or measuring device that you used prior to when you used your baseline. Next is the standing position. The standing position can cause the patient to feel lightheaded or a feeling of syncope, or even having syncope. So we want to make sure that the patient's safety is number 1 when doing this. Make sure you have assistance or help when doing this. Generally, I've used walkers in the past to help patients to feel stable on their feet. Now, a positive test, we use the rule of 20-10-20. What that means is the first 20 is a decrease in systolic blood pressure up to 20 millimeters of mercury. That can trigger a positive test. Also, a rise in diastolic blood pressure of 10 millimeters of mercury, as well as an increase of heart rate by 20 beats per minute from your baseline and comparing it to your standing position. Orthostatic vital signs can be very useful in the diagnosing of orthostatic hypotension. And I just wanted to share this message with you, and thanks for your time.